Well, a lot of us complain about not getting a good night's sleep, and it's not always your mattress. A lot of times it's your sleeping position. So Dr. Nenos joins us today to talk specifically about that, because I've been coming to you for over a month now, I think, and I'm feeling so much better. But one thing we came across is the way I sleep was causing some issues with my one hip.
Yeah, absolutely. So Linda, sleep is really important because it allows our body to rest and re-energize the next day, and it directly affects our health as well. So lack of sleep or sleep deprivation obviously has a lot of detrimental effects on our health. So if we take a look at some of the things that can happen as a result of sleep deprivation, increased risk of depression, anxiety, poor eating habits.
I couldn't believe all of this related to sleep deprivation.
Absolutely, and even things that aren't even listed up there, such as increased risk of breast cancer and stroke. So all these things can affect one when they don't get enough sleep. And most of us are supposed to be getting anywhere between 6 to 8 hours of continuous sleep a night.
So when it comes to sleeping, like we've got your spine here to sort of show what we can do to kind of get that sort of best comfort in our sleep and support the spine the way it should be.
Absolutely. Most people will fall into 3 categories of sleep, and we'll go through the best to the worst. The best one obviously is on your back, and the key thing to remember here is to make sure that your spine is in neutral alignment. So when we're talking about the spine being neutral alignment, we want to make sure that the natural alignment or the curvatures in the spine are maintained when we're sleeping. So on our back, for example, here, what I have here are 2 sleeping aids. So pretend that is a pillow,
right?
And we want to make sure that the curve in the neck and the mid back and low back are there. So that means it's in neutral alignment when you're sleeping on your back.
So you don't want anything major, like I'll just tip this and with the neck going way back, because some people, or up, right? A lot of people sleep like this with 2 or 3 pillows.
Improper pillow positioning. So if you have too many pillows or a really high pillow, what ends up happening is that you can force the neck into flexion or bends like this. Now that can lead to things like waking up in the morning with those neck aches, the back aches, things like that are associated with that. Positioning of the pillow. The best thing to make sure is, like I said, if you want to be using the right pillow so that it's not too big, usually a very plush or thinner pillow or a medium-sized pillow would be perfect for a back sleeper. And you can also use a little back sleeping aid like this for the small of the back.
Well, I think what was really good, as you had pointed out to me too, have someone take a look at you, see what your spine is like if you're on your back or on your side, to see if it is sort of that horizontal, so that you are sleeping the way that you should, so you can get the best night's sleep. Thank you.
Exactly, yeah. So
it goes by like that. We could do a whole series
and that's
on
what
sleeping.
I meant.
That's for sure.
I tried to go through it like
well,
as soon as.
Check out Tree of Life Chiropractic, because they always have seminars and various things going on. treeoflifechiro.ca is where you can go for more information. If you've never been to a chiropractor, I strongly suggest it. Give it a try. It's your spine. Everything's connected. So thanks so much for joining us. We'll see you again on Hamilton Life.